Burlington Board of Health member Libby Wallen-Jevitz will represent everyone in reciting the Pledge of Allegiance. Libby, please. Please turn Libby on.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much, Libby. We'll go on to approval of minutes, March 24th, 2020. If you have reviewed it, does anybody have any comments? If not, do I have a motion to approve the March 24th meeting of the Board of Health?
So moved.
I have a motion. Is there a second?
Second.
That was Libby. Second by David McSweeney. Now we have to go through roll calls, as you know. I'll say aye, David McSweeney. You have to say aye.
Yep, sorry, I was on mute. Aye.
Wayne Saltzman.
Abstain.
Libby Wallen-Jevitz.
Aye.
That is 3-0. Actually, yeah, 3-0-1. Okay, I'll introduce. I'm Ed Weiner, chairman of the Board of Health, and I am here both individually and with my board, and we are all remotely. I'm here with David McSweeney, who is the vice chair, Wayne Saltzman, member of the Board of Health, and Libby Wallen-Jevitz. Board member Mary Beth Welch is involved in a pressing telephone call and cannot be with us this evening. Also with us is Susan Luminello, Director of Public Health, Dawn Cathcart, Recording Clerk, Sarah Kodamash from our Board of Health Administration, who is providing the IT and administrative support this evening. We're opening and operating in a declared state of emergency, and we have specific rules. Mr. McSweeney will provide the legal requirements for this evening. Would you please do that, David?
Yeah, sure, thank you. Can you please, oh, there you go. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, 330A, Section 20, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for the order. A reminder that persons who would like to listen or view this meeting can do so. I guess they can't do it by BCAT any longer, but they can certainly go through the BCAT Government Meeting Facebook Live feed, which is being monitored by Dawn, or they can dial in over the phone, and the phone number is on our website, but it's us also, 408-418-9388, and the passcode is 718-900-362. Again, the phone number is 408-418-9388, passcode 718-900-362. Again, Don will be monitoring the Facebook Live for comments, but certainly call in if you have any questions at all. And Mr. Chairman, that's all that needed to mandated to require to be read, Inspect you.
Thank you very much, Mr. McSweeney. Please note, we are being recorded this evening. So if you have any questions, you can call the Board of Health office at any time, and we will be available to you. Probably need to call you back because, as you know, the offices are empty. But we will really get back to you if you leave a message. I don't believe there is anybody on the line which would represent Citizens Time. If anybody, please identify themselves. I don't hear anybody. So we'll go on to Chairman's report. We are in extraordinary times. Our town has and continues to face continued and new challenges every day. Every hour, something is different. I'm proud, however, that we are meeting all of the challenges that have been placed before us. We're using plans that we developed and we have drilled and practiced months and even years for this situation. We've been employing novel and innovative solutions to many of the twists and turns that have come before us. Our Board of Health staff and Medical Reserve Corps continues to work every day to ensure public safety. Before we begin, I want to thank our staff, many volunteers, and elected board members. I want to especially thank our Director of Public Health, Susan Luminello, who's provided the highest of leadership of the town. I also want to thank our Administrator, Paul Sagarino, who has led and coordinated, along with Susan, so many initiatives that have come before this community. They have helped keep this Burlington safe. I talk multiple times with Susan and Mr. Sagarino every week, and I'm sure they're getting pretty sick of me now. But there are so many people that I have to thank. For instance, and most of all, our Medical Reserve Corps volunteers that have provided outstanding service to the town of Burlington. I'm going to read their names. It'll take a minute or two, but I think it's important. MRC nurses, public health, individuals doing contact tracing. Connie Rayner, Lucy Miller, Heidi Mover, Francis McDaglia, Ann Reisman, Ann Henry, Tony Dardino, Maureen Farrell, Carol Abruzzo, and Beth Moon. We have school nurses, town employees who are doing contact tracing. Rosemary Pascal, Jessica Guerin, and Grace Neves. We also have non-medical volunteers from our MRC who have worked not only during the day, but weekends and evenings as runners for paperwork. Roger Morrison, Janice Leahy, Rita Shah, Erin Spiropoulos, Ann Carwan, Bill McCarthy, Pooja Singla, Madison McDonald, Sumaya Abrar, and Jean Perry. In addition, Susan has another group that she wants to thank. Susan?
Yes, thank you. This is town employees who have come forward to volunteer to assist the Board of Health. Nicole Runyon, Christine Sinicola, Kelly Lehman, Eileen Coleman, Melinda Sullivan, Debbie Callahan, Marnie Smith, Dan McCormick, Lynn Mills, Patty Walsh, John Luther, Steve Doyle, Kim Piggott, Sandy Madigan, and Amy Warfield.
These people have volunteered above and beyond their responsibilities as employees, and we thank both the MRC and those individuals. There are no subcommittee reports this evening, so we're going right to site plan and special permit. These are under applications 150 Lexington Street, which is the parking lot for Kohl's. This discussion is going to be led by our environmental engineer and our director of public health. Christine Mathis, are you there?
I am here. So I'll give a brief overview, and then I'll let Attorney Vaughn comment as well. The applicant, Arista Development, has proposed to construct a bank with a freestanding drive-through ATM in a portion of the parking lot at Kohl's. This would be the portion of the parking lot closest to the corner of Lexington Street and Burlington Mall Road. The project plans to tie into the existing stormwater management system that is in place in the Kohl's parking lot. And a phase one site investigation was done. It had no findings of recognized environmental concerns. It did, however, acknowledge the general sort of widespread area of groundwater contamination in the area, and that is not from this applicant or Kohl's, or it is from past practices, past businesses, and it's throughout the area. Attorney Vaughn, did you want to add anything?
Good evening, Mr. Chairman and members of the board. Can you hear me, I hope?
Yes.
Yeah,
We
okay,
can.
great. We have a few folks that are on this evening, if you needed to hear from any, but we have Joe Salvetti, who is our LSP with Stantec, Phil Henry, our civil engineer, along with Samantha Bergner, who's with Citizens Bank, and Doug Benoit with Arista Development, their development partner. So I think Christine did a good job of summarizing what the project is, but basically what we are proposing, we have an application before both the Planning Board as well as the Conservation Commission, just given the proximity of Great Meadow adjacent to us. But we're talking about building a small 2,700 square foot Citizens Bank retail branch that would be located in the outer limit of the parking facility in front of Kohl's. I suspect that you're all familiar with Kohl's, the building. Obviously, well, I shouldn't say obviously, but I remember it was a Bradley's many years ago. So it's been a retail site for many, many years. But Citizens Bank is looking to relocate an operation that they had up at Mall Road across from Leahy. This would be a new location for them, a relocated location from where they were. This is an area of that parking field that if you've driven by and are familiar with it, it's very rarely used. It's overflow area that they feel that this would be a good and productive use of that portion of the property. So we will be making some upgrades to the site as part of this, and maybe, notably, we're adding a fair amount of green space, open space to the site. Another 8,500 square feet of that, which is, not a small amount. But to Christine's point, we do recognize that although there's no evidence of contamination on this property or generated from this property through the years, we are downgradient, I guess. So I know that one of the conditions that Christine had drafted and suggested to the board, which we're comfortable with, is just having a vapor intrusion barrier built as part of this proposal. So this would be a slab on grade building. There wouldn't be any basement. So that's something that we're aware of that comment and are fine with it. So didn't know if you felt the need to hear from Joe Salvetti, who's the LSP, or if you had any specific questions for him or our civil engineer or any member of our team for that matter. I don't want to bore you with a long presentation. If you would prefer that you just have more targeted questions, happy to answer them.
Can you hear me? This is Ed Weiner. All of a sudden I lost my picture here in front of me. But you do realize that condition requires an active barrier. You do realize that? That it's not just a piece of plastic, that is an active barrier system.
The condition indicates that it is unless it's changed from the version that I saw earlier, Dr. Weiner, but the vapor barrier system be installed in accordance with the vapor intrusion guidance, and that if the Board of Health requires an LSP opinion and analysis based on groundwater data and/or indoor air monitoring results, among other factors, that vapor intrusion protections beyond a membrane vapor barrier.
I was under the impression that that required an active system. Christine or Susan, would you please comment?
Sure, this is Christine. So they're going to install a passive system that can be made active, and they will monitor either with groundwater monitoring data or indoor air quality testing so that they know when that system needs to be put into, when and if that system needs to be put into active mode.
We have no idea if there's any contamination or not. And are we putting people at risk not knowing what's going on in that area? I mean, how do we know? We have no groundwater testing at all in that area. We have no idea if that area is contaminated. We're going to have, I think you mentioned 20 people in the building. So why? So I thought that included an active barrier system. Maybe I'm wrong, but that's what I thought that meant, because we don't know what people are going to be exposed to. Now, I'll open this up to I'll open this up to the other board members who had the same question to Susan. So I'll open it up. Susan, what was your take on this?
Yeah, Ed, hi, this is Susan. So I'm looking at the condition now. So that would be proposed condition 1. So, and let me just take a look at this condition. Yeah, so you're correct, Ed. This doesn't say that it needs to be an active system. It just says that it has to be included in the building construction and in conformance with the vapor intrusion guidance. So we would need an LSP, but what it does require is an LSP opinion based on groundwater data and indoor air monitoring results. So they have no groundwater data. So I guess the question is here, are you planning on collecting groundwater data? Maybe we need to hear from the LSP.
Yeah, I think that might be helpful. And just so the board is aware, the system would be designed so that there would be, piping to be able to convert it to an active system if it were required. But you're correct. I mean, we would have to provide evidence either through groundwater sampling or through air quality analysis that active system, wouldn't be, required. But let me ask Joe Salvetti if he could weigh in, because I think he's the best person maybe to speak to this.
Maybe
Joe?
muted.
Joe, are you there?
I am here, yes. You should be able to hear me.
Yes.
Can you hear me?
We can.
Okay, good. All right, folks, good evening. Thank you. Yes, what we contemplated, because you're right, we do not know what the groundwater quality is in the area. So what we had recommended was that measures be implemented during construction. So underneath the concrete slab, we will have a vapor barrier. Below that vapor barrier, we will have piping that will be brought up through the building. So in the event we did identify a problem through testing, that this system could then be made active. Because we're not a disposal site per se, we don't need to jump right to a permanent system or an active system, excuse me. That would have a lot of requirements to be to get with DEP, to have telemetry on it. So our thought was, yes, we'd build the system, and as per condition 1, through either groundwater data or indoor air monitoring, we'd evaluate whether any protections beyond the vapor barrier would be required for protection of occupants. And so once the building was built, there would be a program that would include indoor air testing so that we could make that determination. And based on that...
Is there... I'm sorry, can everybody hear me? I'm sorry to interrupt you, Joe.
No. Yep.
So I guess my question is there, and this is David McSweeney, is there a reason why we can't get testing ahead of time to understand if there is, and then we can just go with the passive right from the start, or is it the length of time that it takes? Or why haven't we collected groundwater data already?
Yes, we didn't collect any groundwater data at the time because we didn't have evidence of a release. We really, at the time, were just thinking this was a pretty conservative measure. So we didn't do any testing at this time. Down the road, the thought was there's a program in play with the bank where they do annual testing so that annual indoor air testing could be used to support.
Is there a reason why we can't do testing ahead of the project? So we understand if there's contamination or not to worry about? Because I'm with you. I feel more, just as a general statement, I feel more comfortable that it's a slab versus a basement, right? And that, but it's still a good size building with, potential of having a lot of customers in and out of there, and the work is out of there every single day. I'm just curious if, and I get where you're coming from, that it might not need an active, but we're just going on assumption. Is there any way we can get data ahead of time to say there is, it's below the limits of contaminated site, and a passive system is more than fine?
Are you aware of the plumes in that area? I mean, we've been looking at these plumes, this board, for years. And those plumes have been moving pretty actively because of the water treatment plant that is, for lack of another word, sucking the water in that direction. So we have no idea what the contamination levels are under a building which is going to house a lot of people. I just gotta say, are you gonna be drilling some wells and then put this once and for all behind us? Because right now, you're gonna do it in the future, which means 6-8 months, people could be exposed to contaminated organics. I don't know if that's an issue or not. Have you reviewed what's going on in those plume areas underneath the mall and within that area and how they're moving?
Yes, the data, as you know, sir, has been around since the 80s. There's no real great study that I could find that really defined the nature and extent of the contamination within the aquifer. So that's why conservatively I recommended to my client that we wanted to implement this because we did not know. You're right. At the end of the day, collecting groundwater data would identify groundwater quality at this time.
Do that, Christine. Susan, you were speaking last.
Well, I think it's a fair trade-off, right? Either we require an active system just because we don't know, or maybe we just get groundwater data ahead of time. I think testing's pretty simple, although, you got to drill, but, let's figure it out. And if that's the case, then we don't even have to maybe even worry about active to passive or testing on a regular basis or as frequently. And I'm just making that up. I'm just saying maybe let's let the data drive where we're going with this.
Hi, everybody. It's Wayne Saltzman. So I'm agreeing with our chair and our vice chair. My bigger concern, and our chair has mentioned this a number of times when the vapor barrier issue has come up for different projects, is that we're not just concerned about months or a year or so. We're concerned about the duration of, a greater duration of time down the road. And my concern is that if this isn't addressed now, maybe it may be addressed in a year, maybe, but, after Citizens comes and goes, whoever the next tenants are, and, looking 10, 20 years down the line, could we have an issue? I think this is something that our chair has been pretty consistent with regard to a concern.
Mr. Chairman?
This is Mark. I think that, we're all talking the same thing. I mean, look, at the end of the day, if it needs to be done, we will absolutely do it. I think the question was whether it needed to be done at the beginning if we're building a system that can be converted easily enough to an active system. I think the desire was not obviously have to, go to that level if it's, absolutely not required. That's all.
Mr. Chairman, this is Libby.
Yes, please.
I think it's important that we have a baseline before we jump off into a project, and getting the groundwater, tested now would be better for future issues, should there be any. If we find there's none now and then we run into issues 10 years from now, what do you do?
Mr. Vaughn, we're worried about the health of the people working there, and we have no idea. I think your LSP put it right before us. We haven't evaluated or know anything that's in that area since the 1980s. That is more than approximately 40 years ago. We don't know where that contamination is right now. We don't know if it's sitting right under that proposed building, or it's far from that building. The issue for me is there are going to be people in that building, and I worry about that. We've been very consistent about these types of buildings. Either we do something active and we forget about this and not worry about what's under it because we're going to move it away, or we find out what's going on there and put in a well or two. So I just worry about people. And unless your LSP can tell us that there's absolutely no danger, I got to just ask the question, as my board has asked the same question.
No, you're right, Chairman. There's without actual data, we cannot sit here and tell you there will not be an issue.
How long would it take to get, because I think what I'd like to do, to not slow this down necessarily, but can we approve it with a change or an added condition that you get groundwater testing, and if it comes back below the standards and it's approved by the staff at the Board of Health, you can move forward with a passive system? Is that possible? Can we put that in as a condition?
Mr. Chairman, this is Susan. So that's basically the way that this condition reads, is that they need to collect the data, and based
but
on
Susan,
that,
I think it's worded that, well, at least my interpretation of what they're presenting is that they want to build a passive system and test over time. And I'm just saying, or passive to active system and test over time. I'm saying, let's get the tests up front, and then they can move forward. And maybe they still are required to test over time, but at least we know we're putting in the right system.
Right, but what I'm saying is I think they read that condition that way. That's not the way that I am reading that condition, this condition.
Oh, okay.
That you can test over time, that you put in a passive system and then test over time. This condition to me is that you have to do a vapor barrier system in accordance with the guidance, and the guidance requires you to do testing. And so I suppose it would be up to the board that they could, if they so chose, instead of having this type of condition, they could have a condition that says, well, then just put in an active system and keep the active system running, either or run it when people are in the building or something along those lines. That's what we've done before, is said, in lieu of testing, said, okay, put in an active system and just keep that active system running. I wouldn't recommend doing a passive system and then testing after it, because the only problem with that is how often are they going to do the testing? Is it 1 month after, 6 months after, and then when does the testing stop? And when do you decide, not to do testing anymore? And there is no real requirement for testing because they don't fall into the MCP system. So the only requirement for testing would be those requirements that the board chooses to put upon them.
You don't own the land. This is Ed Weiner. You don't own the land, correct?
That is correct.
So
the land is owned by another party.
Which
who
means,
obviously are aware of our application and support it, but yeah.
so the question would be, would they want groundwater wells placed in those areas? Which would then end the discussion one way or the other, and find out if their parking lot was contaminated or not, or is it worthwhile just to put in the active system, which you're going to build anyway?
So, hey, folks, Joe here. One thought as we're talking about this is, there's some nuances as one of the folks just mentioned, because we're not in the MCP, so, some of those testing requirements wouldn't really come to bear. But one of the thoughts as we're sitting here and I'm listening, is perhaps we have the condition be that a radon type system be employed, and use that as a measure to make this, conservative measure even more, to make the passive system a little bit more active by having it be a radon system and not something that is triggered or mandated through an MCP type of activity, but look at that as a conservative measure as part of a best management type plan for a new construction in this area, without then maybe looking at putting in a bunch of wells or doing indoor air monitoring. So maybe that might be a way to get an active system in, and then it's just a radon system. The nuance is it's a radon system, not a system for solvents.
I'll have to yield to either the director or the environmental engineer. I am not as familiar. Well, I am familiar, but I'm not sure the significance of that proposal.
So this is Christine. So the an active radon type system is is a condition used for 181 Cambridge Street, which is the site where they have known VOC contamination next to Papagino's. And we could certainly sub in that comment for the one that we have here.
Would that be Christina, then in addition to a passive system, so it would be passive to active with a radon system installed? Is that how it would operate?
Well, it's a membrane or liquid boot.
Right.
And then it's automatically active.
Oh, I gotcha.
It has the pipes and it has the blowers.
Gotcha.
Right. So instead of march down the road, putting a blower on, the radon fans are not that intensive or expensive to run. It's an electrical component, and then as I was listening a little bit to, maybe not get into a situation where we put in wells on somebody else's property and then kind of get into a long-term monitoring program, then really, as long as the fan is running, it's going to protect any vapors from getting into the building, or prevent rather any vapors from getting into the building. So it becomes a active measure that is conservative in its approach, to just avoid the whole question of will vapors be able to get into the building. That's one. Interesting to hear, Christine, that's on another property. I just think it might be a cleaner way than getting into a lot of testing down the road, and I'm not even sure where we'd be with the current owner is testing, as I think somebody raised the question.
Christine or Susan, any thoughts on that?
Yeah, so I'm not sure the difference between, can you, to the LSP, can you tell us the difference between what would be required under, say, the vapor intrusion guidance, and the difference between that and the radon system that you're proposing? Is it just the blowers are different? Is that the difference?
No. Basically, we would implement guidance from the vapor intrusion for the membrane, and we would have piping in there, and it would be exactly the same. The nuance that I'm presenting is that it's a radon system versus a system designed under the MCP. We'd still employ technical guidance from the vapor intrusion document to build it. It wouldn't change the construction of the system.
So I guess for my non-scientific mind here, Joe, just so I'm clear, the net result of it would be that it accomplishes the same thing that an active vapor intrusion system would accomplish, if not more?
Correct. It would accomplish the same thing, but it would be active from the get-go and not passive. And folks are right. I mean, in the vapor intrusion guidance, there's a bunch of testing that would need to be done over the years at an MCP disposal site to confirm that the passive system is working. So this way, calling it a radon system it's not a remedial response action under the MCP, so calling it a radon system and turning it on would fulfill that objective of controlling vapor intrusion.
Well, let me ask a question, if you wouldn't mind, and Mr. Chairman, sorry for interrupting, but so if we, and I'm tending to think that might satisfy the need, but if I think along with that, we'd still require testing, air quality monitoring, and we find out that it's not sufficient, it's not working enough. Is it built, or can it be constructed that we have to deploy a full active vapor barrier versus just using this radon fan, for lack of better terminology or a lack of understanding, that would satisfy any type of air quality issues that arise down the road?
Yes, the system will be able to do that.
So it can be easily converted from this radon system to a full-fledged active vapor barrier.
Right, because the vapor barrier will be identical. So the actual membrane of that vapor barrier will be identical. The piping that will be under the building is going to be put there, but the big difference may be, instead of the flow rate of the radon fan, which is a lower flow, it may need to be a higher flow, so a more powerful blower. But the components that make up the membrane and the piping will be identical to what we built for a disposal site that had a big problem. It's just much more cost effective and less intrusive to put it in when we're building a building like this. Put it in, it's done. Never have to worry about it.
I mean, I tend to be fine with it. I would defer to the professionals, the engineer and the director, but I feel like that's a logical and kind of halfway point, meeting of the minds on this.
Susan?
Me, I just need our staff to weigh in if it sounds logical to them.
That's correct, because I'm not sure. I'm Susan, I didn't have it. In fact, if you can't tell us tonight, Susan, I'd be happy to continue this because it may be a viable solution. I just don't know.
Yeah, Christine, do you have the wording? Because we don't have the wording for a condition like this right in front.
Hold on, I think I do.
Susan.
Yeah. So I'm just trying to figure out what David, what you were getting at. Are you proposing that they put in this radon system? And actually, I'm not sure. I mean, I don't remember just actually myself this discussion before on another site about a radon system or being put this way. So.
Well, it was definitely before my time on the board, but
Well,
Christine says, yeah.
181 Cambridge Street. That's
Which
not
one's that?
long ago. Which one was that?
Yeah, that's not the
next to the Partners Care. I thought that was an active system.
Yeah, I thought
So did I.
too. Yeah, that was active.
It is an active radon style system.
So I'm not sure if that's what he's proposing because he said radon system. So I don't know what.
Well, it sounds like that's what he's proposing, but
Yeah,
I'll
Correct.
defer to Joe.
Correct.
it's an active radon system, right?
So a radon system is something, I'm thinking radon system, something you would put in your home, in your basement. Is that what you're proposing?
It's
Yeah,
the
still
and
saying
it
it
would be
181 Cambridge Street was a little bit more complex than that.
right. If a typical radon system doesn't have the vapor barrier, but we would put the vapor barrier in too. Typically, a radon system in a house is literally just a pipe with the radon blower up the side, not the full membrane. Typically, and there's both cases as well, but yes, our plan here would be to include the vapor barrier, include the piping. The pipe goes up through the vapor barrier, it gets sealed at the vapor barrier, and it then goes up through the building and emits to the atmosphere. So it is, as Christine is saying, it is an active radon style system.
So,
Mr. Chair,
go ahead, Wayne.
you're not the chair. Mr. Chair, it's Wayne Saltzman. So this may be a viable option, but it does seem that with regard to language and understanding nuances, our own staff is not prepared tonight to advise the elected members as to a proper course of action. And given that, I'm going to make a motion that we postpone approval of this site plan until those decisions or language are determined. That's all.
Hi, it's Christine. Sorry to interrupt. I can read you the condition that we put on 181 Cambridge.
First of all, do I have a second? So I have a motion and a second. Okay, now we can discuss that.
Sorry. But I can read you the condition that we put on the 181 Cambridge Street, which is an active system. It says, do you want me to do that, Mr. Chair?
Okay, it's part of discussion, absolutely.
Okay. The Board of Health requires that a vapor barrier system and a radon-style active soil vapor mitigation system be included in the building construction. The vapor barrier and mitigation system design will be approved by a Massachusetts registered professional engineer and a licensed professional. Applicable indoor air quality testing will be conducted prior to building occupancy in 6 months thereafter. Continued air quality testing is required every 6 months if the mitigation system does not remain continually active. Air quality testing results must be submitted to the Board of Health following receipt of the results.
Okay, thank you.
Just-
So, Mr. Chair, is there room for discussion?
Yeah. Yes,
So,
please.
you know, I certainly want the rest of the board to be comfortable with this and certainly want to follow the lead of the staff. However, we have a system like this in town already that we recently, sounds like approved, that we didn't maybe necessarily understand what we were approving. They're asking for the same thing. I would tend to, you know, as long as Christine's comfortable, which obviously she is because we just approved it in a much worse location in town, or not location, but situation. I'm okay with moving forward as long as the staff is okay moving forward. But certainly I want the other board members to be comfortable with that.
Yeah, Mr. Chair, it's Wayne Saltzman. I will rescind the motion if our environmental engineer is telling us from this language that this is a purposeful way for the board to move.
Mr. Chairman, it's Libby.
Yes, Libby, please.
Based on what Christine read, I can be on board with that. And I think, you know, it might be a viable solution.
Mr. Chair, this is Susan. So I just wanted to make sure that, so part of that condition is that they are going to do indoor air sampling. So
Yeah, absolutely. I would require that if we were going to approve it. Yeah.
Yeah.
So one question I have, and let's say we do air quality and it doesn't work. Is the piping in there that an active system could be installed in case it doesn't work? I mean,
we just talked about that. That the system can be easily converted into a full-fledged active vapor barrier.
Is that true?
Yes,
I'll
it
ask
is.
the LSP.
Yes, sir, it is.
It is.
Yes, it is. Yes, it is, sir.
So my only question would be, though, Mr. Chairman, is who is required to do the testing, right? Is it the occupant or the owner of the property? Because somebody needs to pay, if there needs to be upgraded, somebody needs to pay for it. So who's on the hook? I guess it's your client, Mr. Vaughn, right?
No, in this instance, it would be Citizens Bank that would do the indoor air quality testing. So that's something that we've already discussed with them, and you know, Samantha's on the phone from Citizens Bank, and she's aware, and they've done this at other locations where they've needed to.
Okay.
Again, we're only interested in the safety of those people who are working there. And if both of my professionals feel that this system will work along with air quality testing, I'm willing to go along with it. And I'm assuming that both Susan and Christine are satisfied with this, correct? Susan?
Yes, I'm as long as they do the sampling as well, along with it.
Yeah. So
Okay.
Before we make a motion, though, I do have one other minor question on the site that I'd like to ask a question about, Mr. Chairman, if you don't mind.
Please.
Yeah. So, Mr. Vaughn, I just want to talk about the water runoff a little bit. Are we changing grade at all that's there, and/or changing the water management system, or increasing impervious surface. Can you talk a little bit about the stormwater runoff?
Sure. I'm going to defer to Phil Henry.
Yeah, that's fine.
Here, but I know the answer to one of the questions is we're definitely not increasing pavement. We're actually reducing it pretty significantly, about 8,500 square feet of additional green space. But Bill, maybe you can talk to the runoff method.
Sure. Am I unmuted, Sarah?
I can hear you, yes.
Okay. For the record, this is Phil Henry with Civil Design Group. We were the site engineers on the project. So to answer the inquiry, this site drains from front to back, from Lexington Street back towards the curb line adjacent to the wetland. So we are not changing any drainage. We are maintaining the same direction, and we are mitigating the flow of the drainage as it drains from front to back, utilizing the same storm scepter units that were put in, I believe, in 2001 when the last redesign was before the town. The theory is that since that we are decreasing impervious area about 8,500 square feet, those systems that at the time were adequate are still adequate. And we've dealt with the other departments in town about making sure that they're properly operated and maintained. And we have an operation and maintenance plan that was submitted as part of the stormwater report.
Thank you. And Christine, I'm guessing you're fine with that.
Yes, I am.
Okay, thank you.
So,
as a technical matter, there's a condition about filling out the submittal form. Is our stormwater report sufficient, or should we fill out that form?
This is Christine. You've already submitted that form.
Okay.
so do we have a proposed condition that replaces condition number 1?
Mr. Chairman, I would make a motion to approve.
Point of order.
Go ahead.
Point of order, Mr. Chairman. We have a motion on the floor. Given that we are moving.
You rescinded the motion.
You rescinded it.
Only if the engineer and director were satisfied. So I didn't have a chance to formally rescind it. So
Okay.
I formally rescind it.
Thank you very much.
So, Mr. Chairman, and we can kind of clog through this a little bit, but I'll make a motion to approve the application for site plan 150 Lexington Street with the conditions and modified to number 1 to state that the Board of Health requires that an active radon system be included in the building construction. The system must be conformance. I guess this is all still the same, Susan or Christine?
Yeah, I think we should word it the same way that Christine read it.
Okay, that's fine.
Yeah. Maybe Christine, for the record, maybe you can read that in again.
Sure, I can. The Board of Health requires that a vapor barrier system and a radon-style active soil vapor mitigation system be included in the building construction. The vapor barrier and mitigation system design will be approved by a Massachusetts registered professional engineer and a Massachusetts licensed site professional. Applicable air quality testing will be conducted prior to building occupancy and 6 months thereafter. Continued air quality testing is required every 6 months if the mitigation system does not remain continually active. Air quality testing results must be submitted to the Board of Health immediately following receipt of the results.
So unless it's covered in there and I missed it, but I also want to say that if the testing, the monitoring results come back, they may be required or will be required to pull in a full-fledged active vapor barrier system to replace the radon or something along those lines.
That's good.
That's my motion.
I get it. I want to make sure that our recording secretary has it.
I second the motion.
I have a motion. Dawn Cathcart, are you on?
I am. I'm all set. Christine's going to email it to me.
Very good. With the additional sentence that Mr. McSweeney added, correct? Ms.
Yes, I have that.
Cathcart? Thank you so much.
Thank
So
you.
I have a motion and a second. Is there any other discussion? If not, I'll ask, we have to do a roll call. David McSweeney,
Aye.
Wayne Saltzman,
Aye.
Libby Wallen-Jevitz,
Aye.
and Ed Weiner, aye. So we are 4-0-0. Thank you very much.
Thank you, Mr. Chairman and members of the board. Appreciate you taking the time to talk through it. I think it all makes sense. So thank you.
Thanks, folks.
Thank you so much. Thank you.
Thanks.
All right. The next is discussion COVID-19 response and updates. I would like to please ask for a motion to please add the staff reports. Please move them first, which will give us additional time and it will be a little more efficient. So could I please have a motion to do the staff reports first, please?
So moved.
Second.
I have a motion and a second. All in favor? Well, I got to do it again. Libby Wallen-Jevitz,
Aye.
Wayne Saltzman,
Aye.
David McSweeney,
Aye.
and Ed Wine, aye, 4-0. We're going to go to staff reports. Please, environmental engineer, would you please give us a quick summary? But before you do, I just want to point out to people who are watching this, even though we are in a pandemic situation, we need to remind everybody that the Board of Health still needs to do plan reviews, very much like we just did. Land use, subdivisions, the environment and environmental engineer work, other communicable diseases, including TB, food establishment, restaurants, and all kinds of inspections. So to that end, I don't want you to forget that we're doing a lot of other things in addition to work on COVID-19. So Christine Mathis, our environmental engineer.
Hi, thanks. So I just wanted to remind everybody that we did cancel household hazardous waste, which was scheduled for this coming Saturday, the 18th. So unfortunately, we won't be holding that. I am looking to schedule something for the fall, as we normally have, but sort of waiting to see how things play out with the pandemic. Also, as a further note, just because I've had multiple inquiries, the other outlets for household hazardous waste that would normally be open to residents of Burlington, for example, say they couldn't make one of our twice annual household hazardous waste events because they were moving or whatever the circumstances may be, the other outlets were they could go to the facility in Lexington on Hartwell Ave, or they could take their materials to a stationary facility operated by Clean Harbors down in Braintree. And I've spoken with both of those entities, and both are closed as well. So the only advice I have for residents who are looking to get rid of household hazardous waste is hold on to it for now. And please don't put it in your trash.
Thank you very much.
So a few additional things in my report. As you noted, Mr. Chairman, we are still going on. Construction activities are still going on. So I am still reviewing renovations and demolitions routinely and approving those for the building department. I am still doing test pits because I can do those with social distancing. I did the inspection for the certificate of occupancy for Poly 6 because, again, I could conduct that inspection with social distancing. They had submitted all of their required plans. They were in good order, and the inspection went well, so I signed off on their CO. I have a CO inspection scheduled for tomorrow for Vulcan Forms. They too have submitted all their plans, and they look good, so the final step will be their inspection. As you know, both of those companies are engaged in medical device manufacturing with their 3D printers, and so they are considered essential services. So it was important for them to get up and running. And then the rest of the time, I've been responding to COVID-19 complaints and/or inquiries. If anybody has any questions, I'll be happy to respond.
Are there any questions for the environmental engineer?
Mr. Chair, I make a motion to approve the environmental engineer report.
Second.
I have a motion and I have a second. The second was, I guess, from Libby. Is that correct?
Yes.
Okay, roll call. Libby Wallenjevich,
Aye.
Wayne Salzman,
Aye.
David McSweeney,
Aye.
and I am aye, 4-0. Thank you very much, Christine. We appreciate it. Which brings us now to the Director of Public Health. And as you can see, she is representing the supervisory nurse, the health agent, and the associate health inspector. She's going to give just a quick summary, and then we can ask questions other than COVID-19, in which we will address with a second report that she will be giving right afterwards. So this does not include that. So, Susan, do you have anything that you'd like to point out?
Primarily, all of my activities have been associated with COVID-19. They have shifted, though. So in the beginning, I was doing more work around town employees and town departments and getting the town prepared as to what their response should be. And that was when town buildings were still open, and then in the process of closing town buildings and how to keep employees safe. Now I'm shifted more towards the contact tracing and responding to the governor's orders. So it has shifted from our last meeting from that to more so to this now. So I have no non-COVID-19 things to report on. I did do a summary in my report for Marlene, Sam, and Chris of the COVID-19 emergency activities that they are currently working on. And their reports go back to February, and even I think Sam's goes back to January. So at those times, they were working on non-COVID activities at that time. And mainly now, like the chairman has said, we're doing what's essential at this point. So any Christine's essential activities with regards to approving plans, Marlene and Sam with regards to food service establishments and any other inspections that have to be done. And as far as the nurse goes, mainly she is also responding to other communicable diseases if they come through, but primarily now it's all COVID-19.
Thank you very much. Does anybody have any questions for Susan? I mean, I think that everything you summarized was perfect. Just to reiterate that it's not just COVID-19 for the Board of Health. We're doing a lot of other things that we have to do routinely, and they are continuing. So,
Mr. Chair, can I specifically add that the health agent report very much goes in line with what you just commented. Health agent continues to advocate for the town with regard to food establishments that are functioning currently, and everything else that the health agent does in response to for our town has not changed in the face of COVID-19.
Thank you. Do I have a motion for approval?
Mr. Chair, I make a motion to approve the director report, which includes the other staff member reports as you have indicated.
Second.
Do I
Second.
have, Libby Wallen-Jevers, second. All in favor? Libby,
Aye.
David,
Aye.
Wayne,
Aye.
and I say aye, 4-0. Thank you very much. Which brings us to the staff, it brings us now to discussion, COVID-19 response and updates. Now, Susan Luminello, as you have heard many times this evening, is our Director of Public Health. She will tonight provide an update on the boards and the town activities because she's involved in all of them. In addition, she has agreed to review the top question or two and the answers from those that we have received both in email and directly. So Susan, would you please take it away?
Thank you. So a lot of what we're doing now, we're focusing on contact tracing. We have, as was previously mentioned, several MRC nurses who are helping us out with that. But contact tracing can take a lot of time because we have one case intake can take about an hour, and sometimes with that, we're not always given the correct contact phone number for the person. So sometimes it can take calls to infection controls in hospitals and primary care offices just to get the contact information to be able to interview someone and find out who their contacts were. So right now, we have a number of nurses working on a number of cases. I am basically taking the cases in and I am assigning them to certain people. So I give them a call up, I give them their assignment, they get the paperwork back to me. That's what the runners are for because everything needs to be confidential. We can't do anything electronically. So we are delivering papers by hand back to me, and then those papers need to be entered into the state's database. So myself and Marlene and now Sam have been trained to enter in this information into the state database. So we get those papers back, we enter the information, and then follow-up is needed to determine when the person can come off of isolation and quarantine. So right now, our public health nurse is primarily working on follow-up. She calls these people every few days and determines, asks them about their symptoms, determines when they can come off isolation and when their family members can come off of quarantine. We're finding that, it takes quite a while sometimes for the whole household to be off of isolation and quarantine. But now we're getting to the point that we are able to take people off. So we have had people who are recovering and who are able to come off of isolation and quarantine. So another aspect of what we're doing is the governor's orders. So as you know, the governor's orders have been coming out. They change. We have to stay on top of those. We have to be aware of what they are, what those changes are, and how we are going to enforce them, and how we're going to make sure that everyone is complying. So the most recent one, for example, that came out was on the supermarket. So we had to, we went through it with every supermarket in town and made sure that they had a plan in place to comply with the governor's orders. We've also done outreach to our food service establishments to find out what they're doing, if they're still open, and what they're doing for takeout and how they are complying as well. We, part of what is the state is offering is public health students to help out. So I have contacted the state. I've talked with the organization that is has the public health students to do contact tracing. We are in line to have them help us out. We have, in a few days, I'm told, they're going to be trained, and then we'll be able to assign them cases. So in a similar manner that we're assigning MRC nurses, they will do intake. And then one thing that we will not need to do with them is to put it in Maven. So they will have the ability to get the information into Maven, and then we will be doing follow-up with them. One of the other things that we have also been going on the regular conference calls with DPH. So we have 2 conference calls a week with DPH, 2 conference calls per week with Maven about how to get things into the system and new ways things are updated. And then 1 conference call per week with the Region 4AB Emergency Preparedness Region, basically other boards of health in our region and what they are seeing and what everybody's concerns are and what everybody is working on. So we're busy just trying to stay up to date with the information. Part of the what the state is doing besides the students is that they are working with Partners Health to hopefully get a system in place where Partners Health is going to be doing a lot of this contact tracing. When that is going to happen, I am not sure. So, but when that does happen, that will take a lot of this work off of local public health. And like the governor said, it may not even be possible for us to continue with all of this work based on if the cases continue to increase. So we might get to the point where there's so many cases, even though we have all this help, we're not going to be able to do it all. So I'm told that Partners Health, they're working on it. They hope to get a system in place where they're going to be able to get into Maven and see our cases. And then at the end of the day, all the cases will go over to them. If we don't accept them or anything that we can't handle, we'll go over to Partners Health. When that's going to happen, we haven't been given a time frame on that. We are also working with the Youth and Family Services, Christine Struhan. They have agreed to provide social work services for the people that are on isolation and quarantine. So we're getting information from them, which we put into Maven as well, with regards to what people's needs may be. Some people need food, some need thermometers, some just need someone to talk to, or may need other things. So our social workers are there to help out with that as well. With the volunteers, so we have been working, trying to get more volunteers. One of the things that we did was reach out to town employees as well. I want to stress, though, that we are not accepting volunteers from the public, so no spontaneous volunteers. If somebody wants to become a volunteer, they can join our Burlington Volunteer Reserve Corps. They go to burlingtonmrc.org, that's our website, and they can sign up there and get more information there. They can go to maresponds.org and get and sign up there as well. If they choose Region 4A, Burlington MRC, we will see their information. Katie Capobianco has been working with all volunteers and volunteer people wanting to become volunteers. So that has been a big project because we have a lot of people who now want to volunteer, which is great. So we're going to be tapping, as volunteers are approved, the nurses and doctors, we are going to tap into them to maybe have them do some more contact tracing. So that is what Katie is working on now, just trying to get people queried so that we can accept them for volunteers. So any member of the public will have to go through that process if they want to volunteer with us. We are not just taking volunteers from the public. So with that, oh, and I was going to go over the some of the things that we're seeing. So we've gotten a lot of, well, not a few questions regarding masks. So questions being, I see someone in the supermarket, an employee who doesn't have a mask on. Why don't they have masks on? What about the people entering the supermarket? Stores have been asking, Can I prevent someone from coming in if they don't have a mask on? So our answers to that is that in the governor's orders with regards to supermarkets do need to provide a way for employees to protect themselves. And it doesn't specify masks in general, but masks is a way for them to do that. So we are taking the stance that supermarkets, if they have them available, which they may or may not, but if they do, they should provide them to their employees. So whether or not an employee chooses to wear the mask, they can't force an employee to wear a mask unless that's their policy. You have to wear a mask to work here, but we're not getting involved in their specific policies in their stores. With regards to the public, I always choose to say the best thing is social distancing, but if you can't do that, then should wear a mask. We are not now, we don't have anything in place where the public is being forced to wear a mask. We're recommending that, and we hope that they do that. And then the last thing was what did I can't remember what it was. The masks for so for the people working in the supermarkets, people going into the supermarkets, and then in public. So I think I covered all of that. So that's one of the types of comments we're getting from the public. Another one is people gathering in places. So we're getting lots of, I saw people down in the park. I saw a group of kids gathered here. So we are, of course, we're discouraging gatherings. And we are asking, we did help with the rec department. So they have been going around in the rounds in the parks and just have been asking people to leave. So if they are gathered, all the parks and playgrounds in town are closed. People are gathering in large groups and they see them, they're asking them to move along. So we are getting all different kinds of comments from the public, and we're trying to respond to all of those. So that's it. With that, I guess I'll answer any questions.
Susan, this is Ed. Does anyone else have any questions for Susan?
I just have a comment. You mentioned Partners Health. My understanding is that there's a group called Partners in Health, which is a nonprofit that is picking up a lot of this, and it's not related to Partners as in the General and the Brigham. Am I correct on that, Wayne?
You may be correct, Libby. You may be correct. Maybe that is it. Partners in Health rather than Health. Yeah.
I don't want people to think that Partners
right
is doing it because they're not.
Libby, you are right.
Yeah.
Okay. Thank you.
And Mr. Chair, may I make a brief comment about the director's comments?
Please.
So, I've been privileged to represent the board in support of our community by giving weekly updates on Burlington Cable Access with regard to the ever-evolving COVID-19 situation. So the public knows that I do wear a mask in public. And, what do we know? What do we know along making this personal decision that has been recommended by our government? And we know that this disease is transmitted via droplets. Droplets occur via sneezing and coughing. And we know that those things do exist and can be influential within a certain distance. And typically 6 feet is what has been determined to be the minimum distance of separation to avoid those droplets if they do occur. But a mask is more than just preventing those droplets from going to one person to another. And I use the term being a good citizen. I do believe that we need to show citizenship and support for each other during this illness, at least at the point where it's not a mandate to wear a mask. So yes, we are telling each other by wearing a mask, you know what, I'm taking this seriously. because I know it's a very serious issue. And it's a signal to you to keep your distance from me as appropriate. It's a signal to me to not touch my face. And it's also an additional support for preventing what I have in my sneeze or my cough, or as we saw with that choir in Washington, maybe even with just my my typical breath that's emitted during speaking, what I could possibly convey to you. So I personally do believe in masks. My being a physician aside, I do believe in masks because I do believe that it's one community member supporting another community member when we know that this illness is within our community, and we wish to offer mitigating techniques in order to help it resolve.
Thank you very much. I just had a couple comments. Dr. Wayne Saltzman is a physician. He is a noted geriatrician who has become the Burlington TV doctor. This physician scientist that everybody is becoming comfortable with on television on BCAT. It's a lot of work, Wayne, to go on and to present you as you do now. And I got to tell you, you're better than any other television physician I see on any of the major local networks. And I just want to thank you so much.
You're very
thank you. And it's a lot of work, and I know that. One other comment to Susan. Every other day or so, I speak to Paul Sagarino. Terrific. He's terrific. We discuss what's going on and how the Board of Health can offer additional support. He has noted to us that anything reasonable he's willing to advocate for us, he's willing to get for us, because the board has been doing outstanding work. As he said, we should be very proud of our staff and about this board. So with that, I just want to open this up to anybody else. And then I had a couple other quick things I just want to add for discussion.
Mr. Chair, can I just make a couple other comments about, just to reinforce some things? Is that okay?
Sure.
So for our community out there, the chair jokes with me on a regular basis at our meetings before COVID about my ending a meeting telling people to wash their hands. But we've always known that hand washing is one of the main ways that we can reduce the risk of infection. We also know from studies that with regard to COVID-19, the virus that causes COVID-19, the coronavirus, is extremely susceptible to being destabilized and eliminated by soap. Absolutely no reason why we can't be hand washing. Recommendations are to not use hot water, as that can lead to drying of the skin, but warm water. And I sing a happy birthday to myself twice, and that's about 20 seconds. Hand washing, hand washing, hand washing. I cannot stress to all of you how important that is. The alcohol-based disinfectants that we use and we're familiar with and has been in short supply, those are helpful too, but we have plenty of soap. Hand washing. Second, I cannot emphasize enough, please protect your cough and your sneeze. I remember being on public transportation when this was very early in the COVID process, and there were folks just sneezing and coughing on the train. And I was amazed. So protecting your cough is crucial. And the other issue is number 3, is clean the surfaces that you most commonly use with regular household cleaners. They are effective in destabilizing and eliminating the coronavirus, and that's how people are talking about the activity of these. So those 3 things: hand washing, protecting your cough, cleaning surfaces are crucial. And, I'd be remiss, Dr. Weiner, if as a geriatrician, I did not say, we know very well, older adults are extremely susceptible to having a more serious illness with COVID-19 than younger individuals. So if there's an older adult in your life, even if there isn't an older adult in your life, reach out just to say, how you doing? I'm thinking about you. It not only makes the connection more purposeful, but it helps for those who are feeling isolated, and it helps us understand and know that we are helping others stay well because we're taking responsibility for our brothers and sisters in the community and making sure they're okay. And with that, Mr. Chairman, I yield, and I appreciate your allowing me the time to speak.
Thank you. Two other quick issues. The first is, and I'll open this up to everybody, including Susan and Christine, if she's still on the line. The governor has made a number of recommendations, not necessarily orders. Are we doing enough? And I can't think of anything else that we can do to educate the public, make sure the public fully understands what a recommendation is and the seriousness of these recommendations and how it's so important that they take them. Is there anything else that anyone can think of that we need to do more that we're doing? We do it on BCAT, we do it on our website, we do it with live when people call with questions. Are we missing anything? I think we've really planned for this, but if there's anything else, please give me a call, Susan a call. You have any innovative ideas, I think we're there. But just understand, our governor can be confusing. So, and the last piece here is we continue to release the COVID-19 numbers. I know that we did this since the public was requesting it. BCAT, the patch, they've all continuously included what these numbers mean and what they do not mean. If anybody feels at this point in time that it's time to start releasing those numbers, we can either discuss it tonight or we can discuss it one-on-one. I think that the standard has been met, that people now expect those numbers, and I absolutely hope that they understand that it doesn't include so many groups, including asymptomatics, carriers, and individuals who were diagnosed by physicians without testing. So if anybody would like to make comment on those two issues, please do before we adjourn tonight.
I mean, Mr. Chair, I've been consistent in my messaging to the community in BCAT regarding this, and I've discussed this with our director, and I've discussed it with you. I do not, at this stage, I do not see a purpose on presenting these numbers. We know that COVID is in our community. You just mentioned sources that would not be included in the Department of Public Health report, which is what essentially all reporting agencies are working off of. So I'm sure the numbers are much greater in our community. That being said, people have an idea in their heads of what a threshold number is. The number is less, then people may think that we're not that affected and may think that they can relax somewhat in the precautions that we are advocating for. If the number is higher than what folks consider a threshold, and there is no threshold, but people have ideas in their mind. If it's higher, then people panic. And we know that serves no purpose as we're trying to work together to mitigate this illness. So it's in our community. We know what precautions to take. We know what to do if we're not feeling well. We have medical professionals in our community. I would continue to advocate that we not report, but of course I yield to my colleagues on the board and obviously the recommendations from our director. But that's my feeling on those specific numbers. Thank you.
Yeah, and Mr. Chair, if I can make a comment as well. As you know, and probably most of the folks know, I was not necessarily a proponent to publishing the number on the website, and not because I didn't want to give the information out to the community or, that the board wasn't fully transparent. I just felt there was a number that had a lot of different meanings behind it, or not included in it, and it just didn't serve a purpose, right? It was just a number with no explanation, no context. People were going to, similar to what Dr. Saltzman was just saying, make conclusions, positive or negative, based upon a number that wasn't probably a fully loaded number, and I know it's not a fully loaded number. So I did have concerns. That being said, we did receive a lot of inquiries, not a lot, but we did receive inquiries about publishing a number in Burlington. And I do know that most of the surrounding, if not all the surrounding communities, also publish a number. So I think, that is the request, and we put it out there. I do think that it does a disservice for people that do draw conclusions based upon a number, or how that changes or doesn't change on a regular basis. So again, I'm not necessarily a proponent of publishing it, but if the community is needing it or wanting it for some reason, then I think we can provide that service, with the fact knowing that it is a number. It's not all inclusive of potentially all the cases that exist. And also it does, it's a snapshot. It's a date and time or a snapshot in time. And it doesn't explain a lot of what might go into that number. So again, I'm not necessarily a proponent. I'm not sure there's a tremendous argument one way or another. I'm not necessarily so passionate about publishing the number if the community wants it, but certainly I had concerns of publishing it in the first place.
Libby, do you have anything you'd like to add, or?
Yeah, I was just going to say I can go either way on it. When we talked about it last time, I wasn't necessarily saying we should do it. I think we have a lot of statistics before us, based, from the state and from the federal government, and they all have to be looked at in the same way. And numbers are numbers. And as Wayne has pointed out, it is more probably than what we know. And we don't need to become complacent in any circumstance. We all have to do what has been recommended, because that's the only way we're really going to get this thing under control. And reiterate, numbers are sort of meaningless. Enough said.
Enough said. I think we need to look at this again at the next meeting. But since people are really looking at them, and we continue for every time that we submit them, that we put the limitations on them. And again, BCAT and the patch have been very good about it, that we look at it again. But keep in mind, at some point, we may change our mind.
Mr. Chairman, I'll just add, and I'm sorry to have been monopolizing this arena, but I'll just add that, I was talking with my best friend from medical school, who is a primary care doctor north of Burlington, and we were talking about how much information is out there regarding COVID-19, and the public has no idea, truly, aside from Centers for Disease Control, World Health Organization, Massachusetts Department of Public Health, as being, sources of truth. Public has absolutely no idea otherwise, and frankly, it's scary. It's scary, some of the information that has been conveyed. So, what I can tell the public is that our director has done a very good job at taking information and making it available as sources of truth, things that we can rely on our website, on the burlington.org website. But really, the public if they don't look at our website, they should choose one source, and I would choose the CDC, which has updates on a regular basis, as truly a source of truth, and really try to limit the amount of information that is coming like a garden hose of water to us every single day.
Thank you. Thank you very much.
Well said, Wayne.
Very well said. I agree.
Mr. Chairman, can I
Yes.
just clarify that number as well? So I just want the board to know that number is, and I don't know how other cities and towns report their number, but the number that we report is the number of cases that we have open now. So it's not the cumulative cases. It's not the number of cases that we've had over time. It's how many cases we currently have open at this time. So if we were going to report on the cumulative cases, then we would include those people who came off of isolation, the total number of cases that we've had in Burlington. So right now, it would be more than what is shown on our website if we reported it that way. The way I'm reporting it now is the number of people who are currently infected at this time and have a case of COVID-19. And I don't know what other cities and towns are reporting in their reports, whether that's the way they do it or they're doing it cumulatively. And a lot of these news agencies are comparing from town to town. Who this town has this many cases, that town has that many cases. But the reality is we don't know if the way their towns are reporting is consistent.
Thank you. Thank you, everybody, for tonight. I'll just go around for last comments. If anybody like to make any other comments tonight, we've had a long meeting. Ms. Wolenjevich, any other comments tonight?
Nope, I'm all set.
Thank you. Dr. Saltzman, anything else you'd like to say tonight?
I'll just sign off the way I've been signing off for the past 5 weeks, and that's it. We're all in this together. Stay safe and be well.
Thank you. David McSweeney, my co-chair, my vice chair, I'm sorry.
Yeah, and and I said this the last meeting as well. I do sincerely thank Susan and the rest of the staff. They really have stepped up over the last several weeks. I mean, when the governor imposes an order or a recommendation or advisory, the folks that are enforcing it is the staff at the Board of Health. And it's just amazing the volume of work they've had to pick up in addition to supporting our current business as is, we had a site plan today that we had to review, and they're still continuing to do that work. It's amazing. We have an amazing staff, and I can't thank you all enough. And again, Mr. Chairman, I know I said this last meeting as well. You are in the trenches every single day, and you're fighting the good fight for us. I can't. You are a true not only leader of the Board of Health, you're a leader in this community and leader through this, kind of terrible time that we're going to. And I can't thank you enough as well.
Hear,
Well,
hear. Hear, hear.
Thank you. Thank you. Very kind words. Ladies and gentlemen, we'll get through this. The Board of Health is here to support and do everything that we possibly can to keep you safe and well. Be well, wash your hands, and good night.
Good night.
Do I have a motion to adjourn?
Motion.
Second.
I have to go through it. Dr. Saltzman,
Aye.
Libby,
Aye.
David,
Aye.
and I. Good night, everybody, and thank you for watching.
Good night.
Good night.
Good
Good
night.
night.
Thanks, Ed.
Good night. Thank you.
Thanks, Ed.